Okay, we're already recording. I'm going to go up and select this little felt pen, and then we're going to discuss ectopic eruptions. And you see this quite frequently. A lot of times it doesn't look very much when you just look at it, but you x-ray uh, do a panoramic, something like that, and you can see the upper 6-year molar erupting too far mesial, and it'll eat away the distal root of the deciduous tooth, and if left there long enough, frequently will eat both roots out from under the deciduous second molar, and you'll lose that molar, and the 6-year molar will drift mesial quite far. It can even drift all the way to the first deciduous molar and really crowds out the two bicuspids and the cuspid, and you lose a tremendous amount of arch length. Also, the midline drifts off to that side also. So anyway, we're going to discuss this, and I wanted to show some of the early treatment of it. So this first case we did several years ago, quite a few years ago, before we had brackets and bonding material, proper stuff, and I had to come up with some method to do this. And you can see where this 6-year molar is coming over, and it's eating away the distal root of this second deciduous molar, and maybe the whole root will be gone, and maybe you'll have a portion of the mesial root up in here. But if this stays long enough, it will actually eat away the root of that. You'll lose this tooth. And I'll show you the last case we showed. This 6-year molar drifted all the way up to about here, and then you've got just a very short space right in here to put the two bicuspids and the permanent cuspid, and they just won't go in that space. So the thing is, we need to cock this molar back early. Even if it's eaten this root away, you can push it back behind here and let it come down against that, and this tooth will serve as a space maintainer and keep that 6-year molar in place for the whole duration of the eruption of the permanent teeth. That's what we want to do. And we didn't have anything to do this with, so I sat down and figured out how we could make a little spring and put it in this tooth and come out over here, and we'd make a little deal like this, and it would come up. And then I made an appliance for this child, and this had a hook on it, and they'd go down and hook it into this wire, and it cocked this tooth back. That's before we had brackets and all that good stuff we have today. Now it's no big problem. We would just kind of come in here and bond a little tube on this tooth, and we would take a piece of wire. If this was all that's wrong with it, you can take a piece of about 0.18 wire and maybe make some little round deals in the end of it and bond it back here, and bond it onto these deciduous teeth, and you come off with a little spring like such, and you just have to do like that on it, and you bring this spring, or you put it in there and measure. You could actually come down over here and hook it. It's better to hook it right at the back of one of these bonds, either that one or this one right over here. Either one will work, and it'll put a little pressure on these teeth, pushing up on them, and stay off of this tooth, which already has lost one of its roots back here, the second deciduous molar. You don't want to put any force on it. If you try to push this tooth backwards by putting something in between here and shoving this back by using this tooth only, you will lose this deciduous second molar doing it. It just isn't strong enough, especially where it only has one root or just a partial root in there. And a lot of people will make that mistake. But if you come up in here and get an intrusive force, you can back this tooth right out of that space. So I want to show you what we did at first. Now the other side of the mouth had the same situation. This permanent molar was coming in here somewhere and eating the deciduous second molar's distal root off, and if left alone long enough, it will probably, the cells will absorb the mesial root of that tooth, which we will show a case where that happened. There's 4 cases here that we're going to show. Alright, we didn't have any of the good things we have today, so I had to come up with I put a wire in here and came up and made a spring on the side and did the same mechanics that we do today, and I had to bond this with acrylic in here. I didn't have any good bonding material, so I bonded this wire with acrylic, just acrylic powder and liquid. We etched it, and you could bond in the occlusal surface of a tooth quite well, even with just acrylic like that, after you etch that occlusal surface of that tooth. So here is the little girl looking in her mouth, and the midline is off. Of course, there's a much bigger gap over here than there is on this side. This is drifted over in this direction. That will correct some. Now you can see this deciduous tooth is getting worse from when I took the models right there. And this permanent tooth is pushing on it and eating this root away, and will actually eat the mesial root of the tooth away. And if you lose this tooth, this 6-year molar will drift almost up to the first deciduous molar, and you will lose a tremendous amount of arch length. So when you have these situations, you want to go in and shove this tooth back. You want to stay off of this deciduous second molar and put more pressure on this and the cuspid out here. So I'll show you what we did before we got the good bonding material. We took an impression of this, and I built a little retainer that went in and had a wire right behind the deciduous second molar actually in here. And now I'm wanting to push this permanent molar back out from underneath here. So I made this little spring that fit down here, and it was a powerful little spring. And if this child didn't put this over this hook right here, it would tend to dig into the tissue down here at the bottom. So they would activate this spring and pick it up and hook it over this thing, and it had a bow in it right here, and that just moved this tooth right out of that space. The teeth, the 6-year molars, will back up when you do this. They move backwards as they do, and then this thing will slide. This wire will slide further back on this little device, and this works. And I could bond. I knew I could bond this with. When I etched it, I'd take a brush and a little acrylic liquid and a little powder, and bonded this in there, and just bonded this on the mouth right up there, and it was able to do this. Now this is not what I'm advocating you do nowadays, but this, you need to know a little history of this, and what we had to do in the past. And a lot of people didn't know how to do this. They'd try to shove this tooth back by working off of this tooth or putting spacers or something in here, and then it just lose this tooth. Your deciduous tooth would go, and this tooth would come right on up. And then they'd have to put something in like a lingual arch or something and try to shove this tooth backwards, which was better than nothing, but not all that good. Okay, so we hooked this up on both sides of the mouth, and I think I've got a picture of it hooked up. So here it is. This wire is bonded on with kind of salt and pepper brushed on acrylic, and it held good. We could do quite a bit with bonding acrylic like that. Now you can see these second deciduous molars were already pushed into occlusion more than they should be, and that extra trauma causes the root to resorb even more quickly. So here it is hooked up. Now the patient had to reach in. We bent this hook so it wouldn't just really dig into their tissue up there, but when they unhooked this hook would go up like that. And then they could take this retainer out. Now they didn't have to wear it all that long. This is a mirror shot now, so kind of ignore this part over here. We're just looking straight at it with a mirror, so kind of ignore this portion over here. And when you take this out, this spring would bring that wire up like that, and it would come in, and then the point of it is sticking out labial. It would be a little irritating to keep this in there, so it encourages her to wear this retainer part, and we got our anchorage from that. So it pushes up on the retainer, and it'll back that tooth out like that. So that's the same principle we use today, but we bond here and bond a wire on these teeth and bring this over and hook to these teeth. We'll show that later on. Okay, here's the other side of the mouth. It's got almost identical same things, but you see where these 6-year molars are up here, and this molar is badly damaged, so you don't want to try to push this back by shoving off of this molar. You'll lose it, and most of the time. So here we go. This is hooked up. Now you see this hook is sliding back right here, and you see that tooth is coming out from under this deciduous tooth, backing up like that, and we just stay with it. I showed this case up in Boston years ago when Manning, I believe, was the head of the pedodontic department where Jerry Laffer went to pediatric school, and he wanted me to give him these slides, and I didn't give them to him, and I've always regretted that. That was before, when I showed this, it was before we had the good bonding material we have today, and I regret that I didn't give Dr. Manning that. Now if you remember where this tooth was, this part of this molar was up in here somewhere, and it came out of there and backed up and moved back in this direction from the pressure from this spring is kicking this tooth back. Now this hook was further up here, and as the tooth moved back, this little hook will slide backwards on this wire up here. So you have to remember that when you're bonding it. Always hook it like if you have a wire here and here bonded on, you hook the hook right behind one of the bonds so it can slide backwards on there. Alright, I think we got both of these teeth back like that. Now once they're there, then the tooth can erupt on down into the mouth, and even though this tooth will have, this deciduous second molar will have a whole distal root resorbed and maybe just a mesial root up in here, it makes an excellent space maintainer, and it'll stay there right on through the duration if you have one good root up. Now if there's nothing good in there, then you're going to have to back this thing up and put some type of retainer in there with a little saddle or something that'll hold this 6-year molar back in this place and not let it drift forward, because you're going to need all this space in here to accommodate the cuspid and the first and second bicuspid. So don't allow this 6-year molar to drift forward at all in this type of case. So both of these teeth now have come back to the back, and we're using this tooth as a space maintainer. It'll come on down, and so that's what we did. This tooth stayed there while these teeth erupted into the mouth. We maintained enough room in here to get the cuspids, the cuspid and the bicuspids in. And this side came in also clear. This 6-year molar would erupt right on down beside that. I might have kept it in there a little longer to let this tooth come down. It looks pretty tight in that area right there. Alright, here's a second case that we'll show of an ectopic erupting upper right 6. The distal root of the second deciduous molar is completely gone, so the force to upright the 6 must come from the other teeth. So here's a sweet little gal. She's was a daughter of an assistant for Z. Helmer, I believe, and she's a real neat little gal. And she came in, and I took a bunch of pictures of this, and you can see where the 6-year molar just came in at an angle, ate the whole root of this off right here. And if you think you can shove off of this tooth and shove this back, you got another thought coming, because it ain't gonna happen. This tooth will go, you'll lose it, but you don't want to lose it. You want to stay with that tooth. So in this manner, we design the little spring coming out from here, but you don't really need to go down with your loop. You can actually come up with a loop, you see, and you can make 2 deals if you want, and you can actually don't need any brackets. I don't know why I put brackets on this case. I just hadn't had enough experience when I did this, but we just lay a wire up there that we've made 2 circles in the end, keep the wire from poking them anywhere, and bond right onto that, and then we would come over and bond on this and bond on this, and then a lot of times we come right up behind that, put some pressure on the first deciduous molar, which usually has good roots at that time. And now I want you to watch. This tooth doesn't try to come up here, it moves backwards. This whole thing rotates about here, and it doesn't matter if it's got a second molar or a wisdom tooth, whatever. I see a wisdom tooth and second molar here, but you watch this tooth come up as we activate this. Now, and it's real simple. You don't need anything but a tube right here and some wire and a little glue to bond this on the teeth. And you can do any kind of molar. You can do excuse me here. I get kind of stopped up after talking a while. And frequently we'll do this to partially impacted wisdom teeth back at the back, and they have plenty of room for them. We don't take them out. We bond a little tube on them and upright the wisdom teeth and save a good tooth back in the back of the mouth to do that. So watch this as it goes. It's amazing what happens. Alright, here's a close-up picture of that. The total root is gone, but it has a good mesial root. Now we want this tooth to come back here, and you watch what happens, and it's going to come back there. It'll move this tooth and the wisdom tooth behind it at the same time when it comes through there. So we put this little spring, and we'll just come over here and do something, and you come off, and you can just do like that, and we bond something on here, and we'll come off of this and reach up and hook it over the wire right about there. Okay, after we hook the thing in, now I stuck brackets on here, and you don't need the brackets. I later realized. Now if you notice where this hook is here, let me erase that so you can see. The hook was actually behind the bracket when we started, and this tooth was way over here somewhere, and this was closer in. Now as the tooth starts uprighting, it moves distally, rotates around here, and this part goes back, and that hook slides back. But the force is being pushed down on this good root and the deciduous tooth here at this point. And so this tooth is rolling back. And we do use this tooth in some partial way, and the medial root is good enough to do this. It wouldn't have hurt if we had run the hook on out to this part. We would put it totally. If this tooth had been real weak, we could have run the hook from here instead of up to this point there. Now the tooth is setting up much better. Let's go look back now right quick at where it was and look where it is now. See, it's completely come out from under there. Now let's show it a little bit. Let's see, that was 418. Let's see how long it has been in there. This was 2/21 of 86, and now this is 2/21 of 86. Okay, and now this is 4/18 of 86. So February, March and April the 18th. It's already come back that far, you see, in less than 2 months. Now, after it stays in there a little bit longer, look what happened. This wire went from the hook from here over to here. The tooth not only went back in doing this, and it's shoving the wisdom tooth and the second molar and the wisdom tooth back at the same time. All its force is pushing down on these teeth. We can't tell that this damaged that root that was left in it all. Even though this root is completely gone in here and the nerves exposed, this tooth is still vital. It doesn't kill the tooth when the root is resorbed like that. So this is still a vital tooth, and it has moved this tooth completely back there, and it was down in here somewhere like that. Now this is really not very difficult to do. You just have to get on the side of the tooth to do it. If you have to take electrosurge, or you go in here with a laser and uncover the tooth a little bit, if it's way down in here like that, you uncover it, bond something on the side, just bond a little tube on the side of it, and you can upright any blooming tooth you want to in the mouth. And we do second molars come in impacted, wisdom teeth, we can upright them, bicuspids, any tooth you just bring me a tooth. Even if 2 of them in there, you might have 2 of these springs to do it, but we can upright darn near anything. Now, the mechanics that we have to do that. So I hope you practice this. You can really use it. Now here it is connected up. You see where that tooth was buried up underneath there, and that tooth was gone. Now I didn't need these brackets. I could have just, I think I bonded this on right here, and this is a piece of rectangular wire. You don't even need rectangular wire. You can just come in here with a piece of round wire and just bond it to the teeth. Now we brought the hook up and put it here. You could have brought it way up to here if you wanted to. If this tooth was really weak, if that root is good, then you can put your hook. See, it's right there behind that bracket. Now when it finishes, the hook is back here somewhere, but then this whole bracket moved back in that direction, and the tooth backs out of the hole. And I've seen some crazy things where people tried to do this by pulling this tooth up, or putting a bunch of mess on here and putting a spring to shove this back, I'm sure there are other ways that you could do this, but this is about the simplest, easiest way that I know, and it works quick. And probably about 3 to 4 months we had the blooming tooth up there. Now there it is. This little hook slid from here back to there, while this part here went from there back to there, same distance. We've got a gap in there. So we take this off now, and this tooth will drift back up against that, or you could put some appliance in there and pull it back up there if you must. And there's the little spring that did the work, you see. Now here's another case. We'll show very similar things happening here. Here's a little gal who's got a couple of ectopically erupting teeth. Now, if you take x-ray and you see this happening, you've got to do something in here, or this tooth, these cells will go all the way over and you will lose this tooth right here, and this tooth will drift all the way up to about here somewhere. And then you lose all that arch length. Same thing over on this side. You see it eating the deciduous tooth away. And this is an easy, simple thing that dentists should have been taught years and years ago. I mean, how many screwed up orthodontic cases have been caused by somebody not knowing that they could back this tooth out of here and get it out in the open and allow this 6-year molar to stay down here where it ought to be, then these teeth could erupt into the mouth in a normal manner. There are just thousands and thousands of cases, I'm sure, where kids have had to go through a tremendous amount of orthodontic work just because somebody didn't know how to back up a blooming molar in there. And I've shown this a lot of cases, and then I still see people trying some silly, stupid way to back the teeth up when it's so simple to do like this. So I hope that I'm not too abrasive with people to get them to do that, but it just irritates the heck out of me to see people trying to do dumbass ways to back these molars up when there's a simple, clear-cut way to do it like that. So I hope this little video that we make, and just give it to people. I've been showing people how to do this for years. Now this tooth will come right back off of that. And then I just drew it out on the x-ray so people could see it. Alright, so we bonded this. Now here's the tooth is back there, you see, right behind it. And this will have enough retaining ability to keep the 6-year molar from drifting forward. So both of them are through there, and this is a good space maintainer. We take that off, and you don't have to have anything on there, but the tooth has moved back and left the space open like that. And we'll maintain the arch length. So there it went from here, and you see this tooth backed up to where it's something like that, and this little hook, you see where we had it drawn there, but it has moved back, and in the mouth actually it would slide back like that as that 6-year molar backs up. And here's the both sides. Here's this one has moved back. You've got a gap in here, see? So this tooth rotates something up here. As it went back, it actually ended up with a space back there, see? And people just, it's hard to get somebody to venture out and do that. You don't need any brackets. You just put a piece of wire, bond it to the tooth. You need one little tube, really, and some glue to do this. So there the case was, and we took it and backed those teeth out, and all we had is a wire bonded onto the side of the teeth, you see, right here. It's really quite simple and very cheap to do that. And there, looking at the teeth, there's the bonded wire, and there's where we ran our hook up here on this side and ran it on this side here. As it comes back, this moves backward, and here this moves from here back to there. Now, down on the bottom, we've got space and everything's coming in. This is going to be a mildly crowded case, you see. So you need every bit of arch length you got from here to get this in. And you may have to come in and do some expansion on the case, which we frequently do if it's a flat-faced person and we want to do it. Now this is a mirror shot. Now kind of ignore this portion here. This is all the mirrors stuck in there, and we shot a picture of it so that you can get a straight view of it. Now this little hook went over here and we were afraid it'd come off, so we tied it on. So sometimes you may need to tie the root, but have it loose where it can slide. So as this tooth backs out of here, then this has to slip back over here. And so we've got our force on the cuspids. We're tending to intrude these teeth as we back this tooth up over here. And we just left this one alone. You could have put the hook here and you'd use this deciduous tooth to do that. Now, this side we use it over on that area. Now, coming back here, this is sliding back. Now this one, I think this is the left side. We're put the hook behind the first deciduous molar, so it's slipping back there, and it has come down in place. And you'll see that the 6-year molar is backed out, and you've got your problem whipped right there. And you just take all this off and leave them alone. And so there it's off, and that tooth will stay in for the duration of the case. Now this last case I'm going to show, they lost the second deciduous molar, lost, and this drifted forward almost till it got up to the first deciduous molar. So you see it was gone when we got the case. So there was a deciduous molar in here, and they've lost almost this much arch length. So this is going to be a very crowded situation. The midline is off. These teeth have drifted back some too, and makes it even worse. And I'll show you from the top. You see a little bit of turning of the center of the mouth, and these teeth have gone back, and this tooth is almost back to the first deciduous molar. Now as the upper 6-year molar drifts forward, it tends to rotate on the lingual roots down in here, the big lingual root. And as it did, it kind of turned in like that. You see, this molar didn't come forward, and so it's straighter, and this has a angle like that. So this tooth has rotated, so as we correct it and it goes back, it will also rotate the tooth as it uprights it. So just watch this interesting little aspect of it. Now, coming back, they're biting two on this tooth. That's a closed situation. They've got a little open bite problem. Now, we'll follow this through with several x-rays, and this is the first x-ray that we took of it in 7 of 88, and you can see the second bie, the first bie, and the cuspid. Now all these teeth we're going to try to stick between here and here. This is the permanent lateral. So you're going to have a double time getting these 3 teeth in there if you didn't mind extracting. So a lot of people go ahead and extract, but this was a fairly flat-faced little girl, and I didn't want to extract. So we take these teeth back, and we'll go ahead and put pressure on it and expand it and move the teeth back. Now this was the first. I take a whole bunch of Panorex on this so you can see the molars. So that's 7 of 88, and here the second one is of This is January 23rd of '89, you see. And we haven't really done anything yet, so it's a pretty doggone crowded mess in here. So now we're going to have to back all these teeth up, and we'll come forward with this to some extent and correct the midline. But that's a tough job that was caused by somebody not being able to recognize the ectopic erupting tooth in there. So now we've got a spring in here. We're working off the deciduous tooth. We use them, you see. We're using this cuspid. It's got a little resistance, and we're expanding the whole room in the mouth, you see. Got a spring over here to get this cuspid down in. This cuspid's coming in, and we've got to put both these bias in that place. That's going to be a pretty tough order. And you'll notice the midline was off in this direction. It will begin to correct as we expand this side of the mouth right here. So we're going along, and that's moving quite good. So we've increased, got one bicuspid in, so we put a bracket on it, and we start pushing the spring here, and we're getting enough room in here to get this cuspid in. And over here we've got this tooth dropping in okay, and the midline is getting better. And that's the fourth, I guess, and this is 4 of 90. So we're taking some time doing this, and this has made the case a lot more difficult than if somebody had corrected the ectopic eruption earlier on. So here we've got almost room now for these teeth to come in, and this was the 5th and 12 of 90, and it's going along fine. And now we've got plenty of room for these teeth to erupt into the mouth. So we realize we've crowded up the wisdom teeth, so we're going to have to get them out, which we, I think, do that maybe a little later down the line. So here's the 7th of the Panarexes, and we've got enough room for that to come in. There's the 8th, the Panarex going. No,